I just thought I'd make a video on the individuals involved in my care because if you're in the Sacramento area and you're thinking about going to this hospital, you might want to know that this happened to me. And you can watch my other videos to know what exactly I'm talking about. But my nurses were Emily Lautenstock and Jessica Baden. Emily was in her last day of orientation. She had been a labor nurse before, but this was a new job at this hospital that she had accepted. She had not had kids before, Jessica had, but Emily had absolutely no sympathy for me when I was in horrible pain with an OP baby with a premature rupture of membranes, which most people know is like the hardest, painfulest labor you can have. So, very, very unsympathetic to me at all. She was pushing constantly on my contracting uterus during contractions to try to find the baby because the baby was being pushed lower. And instead of her gliding the monitors lower to catch where the baby was, she just pushed it deep into my stomach. And I kept telling her that hurts a lot. And she just wouldn't listen. She did not care. And I kept asking to be in hands and knees, and they kept telling me it was too hard for them to get me into hands and knees because my epidural was numbing my legs. But they should have, tried to lower the dose of the epidural. And also, the hospital advertises that they can still get you into hands and knees even with an epidural. So they should have done something more for me to change my position so the baby could get out. Also, Emily was pulling on my catheter constantly. I don't think she meant to, but it wasn't locked appropriately. And I kept telling her this needs to be locked appropriately. And it took me multiple times telling her for her to finally change the stat lock. And anybody in labor knows that you can barely form sentences when you're in that level of pain. And the fact that I had asked multiple times for her to just stop hurting me is really telling. I don't know why nurses get into labor and delivery if they're just going to abuse women. And then I had asked for a fetal scalp electrode multiple times because there was concern that baby was having some variable D cells during some contractions. And I said, I don't think she's having those because she's moving just fine. Everything's the same. I think that you guys are just not catching her on the monitor because she's being pushed down. So why don't you guys put a scalp electrode in, because my water's already broken and her head's down. And they were like, well, it's not indicated. It's not clinically indicated. That's what Jessica said. And I said, well, what would make it clinically indicated? And she's like, well, it would be if we're having trouble catching her heart rate. I'm like, oh, that sounds like what we're dealing with. So get it. And it's also not up to them. I had requested that. They should have asked the doctor to come in and put a scalp electrode in. But I think that they didn't want to bug the doctor because the doctor was hard to deal with. So instead of advocating for the patient, they just made my life really hard. And I had this baby that was stuck that really should have been repositioned either manually or I should have been allowed to move the way I needed to. I had also tried to take a nap because after your uterus is done dilating your cervix, there's a rest and be thankful stage of labor where I was just so exhausted. My contractions had really slowed. And I said, I just need a nap. And this is when they were pushing on my uterus and pulling on my catheter, and it's just chit-chatting back and forth, not letting me sleep at all. So all of this led to me getting a C-section. Had they been more supportive and helpful and done their job, I probably wouldn't have had a C-section. And Jessica, every time the doctor said, oh, she's OP, you should just C-section, she'd roll her eyes and say, oh, there's plenty of babies born OP. But she did zero things to help me. And just me trying to help myself get into a better position, they would not allow. And they were trying to get me to practice push, which you're not supposed to do when you don't feel the urge to push. And I also even wonder if I was fully dilated when they told me, because I had no urge for like hours. And I had been feeling, everything, even with the epidural on. I was still having contractions. They were still painful, but as far as the urge to push, I didn't have that. So I think I was still in that rest and be thankful stage. I just had this overwhelming urge to sleep and they would not let me. And mind you, it was a 26-hour labor, but the day before I woke up after like 2 hours of sleep. So it's like 48 hours no sleep, and it's like, I just don't think they understood how exhausted I was. and I'm used to being a 24-hour shift nurse or a night shift nurse, so I'm no stranger to lack of sleep, but this was a totally different experience, and they would not grant me anything I asked for. And then when the hemorrhage happened, first of all, the C-section, they didn't cover my hair with the bonnet correctly. They were telling my husband it didn't matter how he put the mask on because he didn't even have it over his face correctly, and there was like huge gaps where his air could get out. And I'm like, it absolutely matters, you fucking idiots. So they were just like totally unprofessional, absolutely like B-class employees, the night shift weekend crew. When all the senior people have gone on holiday, then you have these leftover rejects that shouldn't even be in the hospital. And I was hemorrhaging, and I had to tell them, you need to call the doctor. And they're like, well, we've paged her twice, like getting attitudey with me when I'm going blind, having chest pain, blood pressure 70/40. I begged them to wheel me to the ER. I begged them to call a rapid response, which they should have done with my blood pressure alone. They did nothing. They said, we'll wait for the doctor. The doctor finally makes her appearance, and also in the meantime, they're hanging fluids on me. And I'm like, you do not hang fluids on somebody who's hemorrhaging, especially after they'd given me way too much fluids in labor, to the point where my left leg was super swollen and my right leg wasn't, because they had me on my left side so long. They didn't even like move me a minimum of what they should have. It's just insane, the lack of care they had for me. But then the doctor finally did come. She refused to give me blood. She said, oh, I don't think you're bleeding that bad. Even though my blood pressure was in the toilet, my heart rate was skyrocketing. I was having nausea, vomiting. I was dizzy. I couldn't see. I had chest pain and shortness of breath. I had impending sense of doom, like I was about to die. I was like, my vitals alone, you should be giving a mass transfusion for me. And I'm saying this as a nurse who has a lot of trauma experience. And I've also cared for high-risk OB patients. So she's treating me like I have no idea what I'm talking about. I'm like, there's no reason for you not to order blood right now. I'm like, why don't you just give me some blood while checking labs? I'm like, you can just order a mass transfusion and then not use the whole thing. Like, just give me 1 unit and see if I improve. I'm like trying to beg her for blood. And also, like, when you have a patient that's dying, sometimes they'll get really, really thirsty and they'll ask for water. And that's what I was doing too. And it felt like I was gagging because I was so dry. And I'm like, gosh, if I gag, I'm going to fucking die, because there's a fine line when you're dying where the patient can Brady down if they are moved, if they are, if they're vomiting, anything like that can cause them to Brady down because they'll have a vagal response because they're so unstable. But these people don't know anything about hemodynamics or trauma or bleeding, even though they're labor nurses and doctors. So anyway, I just thought I should say their names in case you're in the Sacramento area and you find yourself in these people's care, you're in danger. The doctor specifically is obviously who killed me almost. And her name is Dr. Burkhalter. She tried to coerce me into induction days prior to my water breaking. And then when I arrived, she wanted me to get on induction meds, even though I was having stacked contractions. And then she tried to coerce me into a C-section. She finally was successful at that. She tried to cut me before I was even numb. I had to tell her to stop. I was like, I feel that. And she stopped. They didn't walk my husband into the room when I was getting cut open, so he saw everything open. She cut my artery during C-section. She sewed me up. She denied me blood when I was obviously hemorrhaging to death. And then when she realized I was hemorrhaging to death, because the labs proved that, because my labs went from 13.1 to 6 point something, she only ordered 2 units, which is not sufficient at all. And she should have ordered a mass transfusion at that point. And then she took me back and put the JADA in me, and the JADA instructs its users to not use too much force and to put it in just one time, and to if it doesn't work within like 5 minutes, to consider alternative reasons for the bleeding. She's also the only doctor who charted that I had uterine atony. Everybody else said my uterus was firm in midline, including the surgeon who removed my uterus a day later. So I really question if I ever even had uterine atony. She immediately was blaming my body and my choices for trying to push for natural labor as the cause for everything. I had never been on Pitocin up to this point. So it's very rare for a uterus to be boggy when it hasn't been on like bucket doses of Pitocin. But yeah, I mean, I didn't even have uterine atony. What I had was an artery that was cut and probably a bunch of veins too. And I'm a very vascular person. I have a lot of veins everywhere. So I'm sure that, there was a lot there she could have cut. And, the thing is like that happened sometimes and I'd be fine with, a complication happened, didn't intend for it to happen. Sorry about that. But she never owned anything. She never apologized. She didn't even round on me when I was her patient in the ICU, when she was the overseeing OB and my staples popped open. She never came and checked on me and said like, oh God, you were right. You definitely did need blood. Like nothing. And it was because immediately she was probably told by legal to just not even see me. And it's like, isn't that a bad sign? And I don't know how a doctor can have so many screw ups in one night. Like you cut my artery during C-section, which is an unnecessary C-section. You didn't give me any alternatives to get my OP baby out. You didn't assist me in my endeavor for natural labor, which, a lot of doctors are at fault for that. And a lot of women are cut for no reason. But, that's just, in my mind, it's another fault of hers. And then you didn't give me blood when it was obvious that I was hemorrhaging. That is the sin that is unforgivable to me. It's how dumb of a doctor do you have to be to see that your patient's dying and not even recognize it? And then when she finally gets her precious labs, that she's refusing to do any care until she gets labs, which I wonder how she handles a code when the patient has no heartbeat. Does she need labs before she does compressions? It's just stupidity. I've never seen a doctor do this ever in my life. And, I'm a nurse and I'm telling her what she needs to order, like as a nurse would in this time trying to advocate for their patients. My labor nurses never advocated for anything for me. They didn't give a shit. I had to tell them how to give TXA. I had to tell them I needed the blood tubing primed. I said, when that blood gets here, you need to start squeezing it into me. And there was no pressure bag once the blood arrived. Like nobody was like really trying to get blood into me. Mind you, as a flight nurse with just 2 people in the back of the helicopter with a trauma patient who's like been severely traumatized and there's just blood everywhere, I can get 2 bags of whole blood in a patient in less than 5 minutes. Okay, no problem. I don't need an IV beforehand. I'll just IO them. I was also begging for an IO. Nobody wanted to give me that. Because they were like struggling to get a second IV in me. I'm like, just put an IO in. I'm dying. And they're like, we don't do that here. And I'm like, I do. Just get me the drill. I was so worried that I was going to be dead. So I don't know. There was no urgency there. And they were hanging buckets of fluid on me, which, just exacerbates the whole hemorrhage and the DIC that I ended up getting. So obviously these people have no understanding of trauma care. They have no understanding of hemorrhage. They have no understanding of like a high risk OB situation. And it's just really sad. And this is at a trauma level 1 facility, Sutter, Sacramento medical facility. That's where I went, and I had a strong urge to have a home birth, but I was like, if anything happens to that baby or if I need blood, I'll never forgive myself if I'm in the wrong place. And then I put myself in the right place. They have a NICU level 4 and they just totally destroyed me. So there's this huge cultural shift in medicine where we're like really starting to blame patients for the choices they make. And some of those choices involve avoiding medical care for a long time. But I think we need to look at it from a different perspective. Why are these patients so afraid to come to the hospital? Is it because they're being abused the second they walk through the door? Is it because they lose their autonomy? Is it because they are undergoing lots of medical mistakes and malpractice? And medical mistakes is the 3rd leading cause of death. That's really what we need to be looking at. And why can we not master the C-section yet? We've been doing C-section forever. I mean, I read a book, it's called The History of Birth by Tina Cassidy, and she talks about a husband C-sectioning his wife on the kitchen room table because her baby was stuck, and she survived. I'm like, God, I wish he did my C-section. Instead, I had an OB who was board certified, I think from Wisconsin. She was also a military doctor, and I think she got certified in the 90s. And somehow she couldn't accomplish my C-section without destroying my arteries and like letting me hemorrhage while they have all the devices and technology to prevent this hemorrhage and to fix this hemorrhage. And then the final thing she did to me is she took me in the back without pain medicine on board or anything. And she shoved a Jada through me, through my vagina, cervix, and uterus, which is very hard to do. It's a very floppy device. I don't know how she did that without maybe using a metal instrument, which she wasn't supposed to do, or using way too much force. The package says right on it, this should be a gentle thing. And if it doesn't work within 5 minutes, you need to consider alternative reasons for the patient bleeding, because there's a lot of reason a person could be bleeding. Sure, it could be uterine atony, which is most of the time a symptom and not the cause. Or it could be that an artery has been injured. Or that an organ is perforated or something like that. So just none of these things, none of these common sense things, simple things crossed her mind. She documented that she put it in me and then pulled it out and then manually evacuated clots and then put it back into me, which you're not supposed to do. You're supposed to try it one time and it should work in 5 minutes. And instead they left it in me for over 24 hours, which, there's some off-label uses where if you have an extreme hemorrhage, you can leave it in for 24 hours. But while I was in the ICU continuing to bleed, so after the Jada was placed in me and it ripped through all my organs, which happened while I was awake without pain medicine on board, and I passed out, by the way. Then they put me in for an embolization, which was difficult to obtain. They finally got it. The right uterine artery was cut. They proved that in the embolization, and they were able to embolize that side finally. They put me in the ICU and intubate me. There's a nurse there. I think her name starts with a T. I can't remember now. She's older and she's like not good at all at the bedside and not listening to me while I'm trying to communicate with her while I'm intubated. She also tries to hang fluids on me, even though I'm so puffy. I'm like 100 pounds heavier than I was when I had the baby inside of me. And my blood pressure continues to drop with her. She doesn't care. She's just trying to hang fluids. I'm like, I'm probably still bleeding, or I have like a blood pressure issue, like something else is going on. Like maybe I need pressors. But I definitely don't need fluids. And then she took her charge nurse in the room with her and was like, we weren't trying to hang fluids. And my sister was in the room. She's like, you were just trying to hang fluids. I was here. So they were, gaslighting me. And then the Dr. Qureshi, he totally dismissed all my symptoms. He said I should be very thankful to be here and just be thankful to everybody else. And I need to be more thankful. And I'm like, y'all are the reason why I'm in this boat. Like, I shouldn't even be here. I should be home with my baby by now. And my blood pressure continued to drop with him, and he didn't check my labs for a really long time. And when he did see that I was hemorrhaging still, he just gave me like another either 1 or 2 units. Nobody ever CT'd me until like the next shift. And I had another doctor watch me, Dr. Collins, who was also pretty dismissive of my pain. I was like, this hurts worse than labor. Every time they push on my fundus, it hurts worse than labor. And why are they pushing on my fundus when it was very difficult to embolize? I don't know. But they kept pushing on my fundus. And of course, the Jada is still in place. So they're like, oh, we don't see any blood coming out. Yeah, because there's a cork in place. And I keep getting more and more bruising on my flanks and around my belly button, which is a clear sign of internal hemorrhaging. And my blood pressure's dropping and my vision keeps getting worse. So, yeah, it's just a lot of obvious things. So a lot of failures on a lot of doctors' parts. And I think if doctors just listen to their patients, we would save so many people. So my lesson to everybody is if you're not being listened to, you need to leave because you're in a dangerous situation. And if you have Dr. Qureshi, Dr. Collins, Dr. Burkhalter, Jessica Baden, or Emily Lautenstock, RN, then you need to leave because you're in danger. So that's my 2 cents. And watch me get sued for slander or something. Nothing I've said is untrue, but obviously all of this is my opinion. It's my opinion that these people are not safe to be around because just, denying somebody blood when they're hemorrhaging is just, it should be a crime. It should be a crime. I don't think doctors should be allowed to continue to practice. I think they should go straight to jail if they have a hemorrhaging patient begging for blood and they refuse to give them blood. There's a nurse practitioner, a doctorate nurse practitioner, midwife. I think her name's Janelle Green. She just died after a C-section. And everybody's saying that's such a loss and it's so heartbreaking. And I'm like, man, I bet they screwed up her C-section. Like, I bet that was a bunch of medical error. And, you know, I beat myself up all the time. Like, maybe I should have been a labor and delivery nurse before having my baby. But here's a doctorate level nurse practitioner midwife, very educated in childbirth, has protected many women from unnecessary intervention and C-section, and dedicated her life to protecting those who are not able to talk for themselves, speak up for themselves, advocate for themselves, to promote safety with women and children. And she dies. So, you know, we need to stop saying you need to be a good advocate for yourself. You need to be a good advocate for yourself. That's not really the patient's job. The patient's job is to survive the medical situation. The hospital's job is to protect the patient. The doctor's job is to protect the patient. The nurse's job is to protect the patient. I used to say all the time to doctors, you know, if all I was supposed to do is follow your orders blindly, I wouldn't have needed a college degree. You know, you can get a monkey to go give meds. You can get a monkey trained on how to put an IV in and how to inject a person. I have my college degree because I need to know anatomy and physiology and pharmacology pretty decently so that I can protect patients, because doctors make mistakes every day. I am paid to question the doctor. So the fact that I had nobody questioning my doctors and nobody listening to my symptoms that were very obvious. You know, nothing that happened to me is complicated. That's what I can't get over. It's like I was bleeding and nobody gave me blood. How is that possible? So anyway, I'm just very passionate about that. And if you're in the Sacramento area and you're trying to have a baby and you are cared for by Dr. Burkhalter specifically, you need to not be there. You need to go somewhere else. You need to demand a different doctor. And I really wish I had. You know, my entire story would be so different if I had. So that's the end.